How's your
So
week?
it's good. It's a little crazy.
Yeah.
But so get this. So what's today? Wednesday? This weekend, maybe. I don't even know. So Chad said, hey, my dad's he's had some shortness of breath lately. And they
Yeah.
live in a very small town, as you know. So he went to the local clinic, and the local clinic is like, oh, there's a bunch of other people that are having this weird thing. It's just kind of going around. Goes back home, and his dad's name is Les. Very stoic man.
Okay.
Stoic, doesn't complain, doesn't really let anyone know what's going on. So things progress. It goes back and forth to the doctor, and they tell me, and I'm like, I don't know. It sounds like a cardiac thing. This is what I would do, XYZ. He shows
Yeah.
the email to the mom. The mom goes to the doctor, shows the doctor this email, and they kind of just were like, yeah, well, whatever.
Yep.
So then he literally cannot shave because he's so short of breath. So they go back to the doctor. They do some labs. They send him home. And then the next morning, they call him and they said, well, one of your lab tests came back and or one of your tests came back and looks like you have a clot in your lungs. You need to go to the emergency right now. He goes to the emergency room. He has what's called a saddle PE, probably the worst kind ever, right? The worst kind that you normally present with death for the most part. That's all you learn about, right? What's the biggest presentation of a saddle PE? Death. So they do a thrombectomy, literally go in through the groin, and suck it all out. Interventional radiologist did this. And what was really cool is they send a picture of the lungs and they put the clots like where the clots were. And it
Oh
was
my
it
God.
was massive. The doctor basically said like the clot was the size of your palm. And I was like,
Holy crap.
so he's
Seriously.
so he survives this thing, right? So then I say, hey, if I'm assuming like where did the origination of the clot come from? Is it the legs? Like I would do a Doppler to do both lower extremities, do an echocardiogram. I'm assuming you're going to do that whole thing. Yeah, yeah, yeah. Well, they end up not doing that. So they're going to discharge him. This was probably Saturday or Sunday. They were going to discharge him. They decided to do an echocardiogram, and then they find a clot in the right atrium that's literally floating like back and forth with this echo. So they wanna go back in, and they wanted to do a TE and a thrombectomy at the same time, and they pulled out this clot, and again, they show this picture of where this clot is, and it's like, I mean, Les is he's 85, 100%. I mean, it's nuts. Like, it's nuts. He's now unfortunately on 20 milligrams of Eliquis.
I was gonna say, and he's on a bunch of blood thinners now.
Yeah, and so he goes to the farm and, he wants to do what he wants to do. He was screaming to get out of the hospital. Yeah, it was like, "This is ridiculous," but I was just like and it's so sweet 'cause I was able to talk to the docs and the nurses and stuff, and I think I'm his favorite,
Aw,
but,
that's so
and
cute.
everyone's like, even his sister was like, "Oh, well, whatever you say he's gonna do," 'cause, he thinks you're smart. I was like, "Oh, sometimes I am."
Like, I am smart.
But let me tell you, I mean, seriously, like, going forward like crazy, like, right? I mean, shortness of breath,
But you don't have a family he doesn't have a family history of blood clots or anything like
no,
that,
but I
right?
mean, that and they don't have Medicare Part D, so now this Eliquis is super expensive, and now they're not we gotta figure out how to cover it, but, it's like one of these things, and I was telling the people in Kansas, the doctors that I was talking to, I was like, in LA, you have a cold, and you fucking go to the emergency room, right? Like, and the emergency room is like, "Oh," and you have to give them a Z-Pack because you go to the emergency room, you're gonna pay a grand to go there, you gotta get something, right?
Exactly. Yep, they
And then this
expect it.
man in Kansas can't friggin' stand up to shave, and he won't go. I was just like, "Oh my god, this is nuts." Just so backwards.
That's crazy that
Yeah.
he is alive after all of that.
Yeah, I know. And then Michelle's in town, my best friend from Oregon, she's in town, and she was saying that her niece's husband in Alabama just went with chest pain, and he's younger, and he has a blood clot in his lungs. And that guy was a non-vaxxer, so it's not like a COVID vaccine thing or any of that bullshit,
You're
so
like, "You can't blame any of that stuff. That's not what it is." Holy cow. How's your week been with Michelle being here? Good? Have you got to spend some time with
yeah, she's staying at Hotel June. She's staying at your stomping grounds. She has a room, she has a king bed, and I went it's pretty plain.
I told you,
It's pretty
nothing to
plain.
write home about.
No, it is pretty plain. I was like, "Oh, dang," but she did say that the water pressure is amazing. She's like, "It's gonna, like, take your skin off. It's so good." And I was like,
What
"Really?"
floor is she on? It depends what floor you're
She's
on.
on the 8th floor.
Oh, yeah, that's a good one. 2nd floor is the best. Like, it gets a little weaker each floor as you go up.
I mean, she's literally saying that it's super, super powerful, so I can't even imagine what's on the 2nd floor.
Yeah, it's like, takes you off. It's pretty awesome. Yeah, yeah, yeah. The showers are weird though. Ask her what she thinks. Like, I love Hotel June, but you have to like pull the handle twice around. Like, it's funny, it says you know how hotels will say, like, off, cold, hot. Well, this one you have to go all the way around, like, twice, but it was funny, I actually wrote down in our notes, like I thought I wrote down I meant to write it down last time I was in Vegas, hotel showers. It's literally a thing. You have to, like, every hotel you go to, figure out, "What am I pushing? What am I pulling? What am I cranking?"
And sometimes they don't have the H and the C or the red and the cold, trying to figure it out. Like, oh shit, this is the cold one. This is the cold one. God.
Exactly.
And this Hotel June one, it has a friggin' mirror in the
Oh, yeah.
shower.
I love it.
And I was like, ew, I don't want to see myself. Like, I can barely
I
stand
like
through
it
that
because 'cause
like
I'll be like,
naked.
"Are the is that a weird hair there? Is that a weird" and I'll be
I thought it was super interesting that there's a mirror there. And then there's no glass door. Like, I don't like those half glass door showers. Those drive me insane. I get cold. I hate being cold in the shower. I
It
hate
is
it.
it definitely is colder in the shower, and you have to stay right up next to the water, and, like, water starts splurting out. But it's a very minimalist room, like, literally the most minimalist room. Even the mattress is, like, thinner, not as comfy, the pillows are thinner.
Marriott though, right? Well, today, like, this is obviously an offshoot of medicine. So we do have to do little PSAs on things. Um, so crazy enough. So my whole thyroid thing. So to recap, I was just, doing this one day and I was like, oh, that's weird. Was that always there? That's so weird. Yeah, swallowing and I feel it go up and down, feel it go up and down. And so then I went to the doc and they sent me for an ultrasound and they found something and he says, I'm going to send you to a surgeon. So I go see the surgeon and she does an ultrasound right then and there. And she says, oh, yeah, she's with one of her fellows there. And she says, well, let's do a fine needle aspiration on it. And that was like the next step. Okay, fine. But it was so crazy. Like I had no idea what an FNA or fine needle aspiration really entailed. I knew that they were going to aspirate something, right? And then test it. But they literally stick two 25 gauge needles and they do that little spray that like they do in soccer, like the numbing spray. And she's like, "It's gonna feel a little uncomfortable, you're gonna feel a prick, and it's gonna feel a little uncomfortable." It was literally like 2 steps, like, "Bunk," and then they're aspirating, so, like, they're going back and forth, and it was the weirdest feeling. I literally was imagining me having 2 like, 25 gauge needles with 10 cc syringe just sticking out, and I'm just laying here going like, "Oh my god, this is the weirdest." She's like, "Yeah, it's fine," and they're sucking back, and they're doing it with ultrasound, and, "Okay, go a little bit more this way, go a little bit more that way. Oh, yeah, there you are, blah, blah, blah." She's like, "You're gonna be sore for a little bit," and I had a little Band-Aid, and it was the weirdest thing. I had no idea, and you would think that they were gonna tell you, like, "Hey, like, you're just gonna have needles stuck in your throat, right?" And they didn't, and all of a sudden they started jabbing you, and you're like, "Oh my god." So on the other side is being a patient. Like, I'm a provider, so I can do this stuff to other people. It really kinda made me think a little bit more about the patient side of you, and you're sitting there and just you feel vulnerable, obviously, and you think the worst, and you're there, and you're a patient. You're not even a provider anymore. You're and for thyroid and things like that, like, it's not my jam, right? So I don't really know, and you just start thinking things, and I saw this guy come in, and he didn't introduce himself, but he was setting up where the tray is for the biopsy and for the like formalin or whatever they're gonna put it in to send it off of the biopsy and all that stuff, but didn't say hello, didn't say hi, how are you? And here I am wondering if I have cancer, right? So it's kind of a sensitive thing. And again, as a provider, we have to kind of take a step back a little bit and say, hey, these are people that are scared. They have no idea. This is not their job. And for every routine person that works in the clinic, that's their job. That's what they do. They have no other idea. And I get it because it is a job. And how many times are you in your job? And yes, you're a nurse. Yes, you're a PA. Yes, you're doing this. It sucks because you forget about the patient in that way. You don't forget about the patient as far as how you need to diagnose and fix this person, and this is what we need to do. And yes, you're going to be fine, and this is going to help you, right? You kind of forget on the other side of things, your verbiage, what you say, your body language, so crazy, such a different vulnerable feel. And so they did the fine needle aspiration and you like within 30 minutes you can go. I was obviously at the hospital, so I went back to work and then she called me and she says, hey, the results didn't come back either benign or anything else. It was like undeterminate, so now we need to send it out and it's probably gonna be about 3.5 weeks. And I was like, "Oh my god, okay." And she's like I'm like, "Well, what's the worst that's gonna happen?" She's like, "Well, the worst that happens is it comes back something weird and, we just take it out. We'll just take it out." And I was like, "Okay, that's the worst. Like, I'm not worried about anything spreading or anything weird." She's like, "No, no, no." So then, crazy enough, I see her at work in the elevators, like going by the elevator. She was going down and I was going up. And I said, "Hey." And she's like, "Oh my God, hey." And I said, "I think no news is good news. I mean, it's about 3 weeks. I don't know." She's like, "You know what? I don't even know. I haven't even checked my inbox, but let me check my inbox. I'll call you." So that day she calls me and she says, "Well, it's like," she's like, it's one of these things where you can't really tell, but it came back on a grading system. It was grade 4 and it said suspicious. It didn't say it was, it didn't say it wasn't, it just said suspicious." And she said, "So, at this point, we would just take it out, just do the right side lobectomy and take it out, outpatient surgery. You can do it on the Thursday, take off Friday, go back to work on Monday, not a big deal. And once you get it out, it's out. But within whatever you want to do, you can do it tomorrow. You can do it within 6 months. There's no urgency. It's not a big deal, but we want you to do it. You got to get it done." Okay, fine. So yeah, so that's where I'm at, which is super crazy. And actually we started talking about it. And is it because I was exposed to all this fluoroscopy during surgery? And she's like, "No, I mean, honestly, like, we see this for people in Chernobyl, or like if you're in Chernobyl, I could say yes. Or, if you were laying on the table and you had all this fluoroscopy like beaming down at you all the time without anything." She's like, "Maybe, but no." She's like, "I don't know. Like, there's no real reason for it. So
So
I
now
think,
you have to decide when you're gonna go and get it done,
yeah, I think I'm probably going to do it maybe April-ish or something like around Buggy's Easter vacation. But
like around break, so you
yeah,
have some downtime?
maybe a little bit.
Yeah.
But
Is
so
that
that's what
scary that you're waiting?
painful swallowing, hoarseness, or if I feel like any sort of like if I feel like almost short of breath or like I feel like something's pressing on me, then they're
What
like, "Take
about
it out."
you, like, feeling like you can't swallow or things are
Yeah,
getting stuck,
those
stuff like
things.
that?
Yep.
Got it.
Because it's like
Okay.
right on your, so when you swallow, it kind of goes up and down. And that's literally where your thyroid is. It kind of sits over your thyroid cartilage there.
Interesting. I find that lately I don't even tell people I am a medical professional because I find that a lot of times they'll assume you know something. And what they need to
Oh, when
know
you're a
is like,
patient.
yeah, when we're the patient. Because like you said, you don't know thyroid, right? And I will say like if they find out I'm in healthcare, they're like, "Oh, you know." And I'm like, "Oh, I actually don't. My background's labor and delivery. I don't know this. Do you mind walking me through it?" Right? Or sometimes when I first got out of nursing school, I was proud. So I'd be like, "Yeah, I know. I didn't freaking know." You know what I mean? So it does remind you like, "Hey, sit on the other side, take a moment, realize that every patient you touch is scared," right? Like, you knew those were formalin bottles or that those were instruments, but you think about how many people have no idea what's on that table. And if they're thinking cancer, they're like, "Oh my god, is what's gonna happen? Are they gonna take my thyroid out right now?" Right? So, it is a good reminder.
Or just even like your verbiage, like I think I was, where was I? We were doing something. It was a medical procedure. I don't know, let's say it was a zit, and patient's face down, has no idea, obviously kind of scared, and you're like, "Oh god, that was, oh good," and they're like, "Oh, what? Is that good? Is that bad?" Like what, so it's like what you say, or if you're looking at an MRI, and you're like, "Oh my god, that is the biggest whatever," it's like you don't know on the other side. And even as a patient, you're right. Like, you're a medical professional, and sometimes they feel that they can not explain it to you. But by the same token, when I see someone who's in medicine and they're the patient, as the provider, I know I can speak the lingo to them, so I can say things that they'll understand, and it makes me be able to explain it a little bit better to you. But there's still that whole thing of like, "Hey, and you don't want to insult them and act like they don't know, if you're a medical professional. So you can be like, "Oh, you know what a CBC is?" And you're like, "No, what is a CBC?" It's interesting, but definitely, it makes you stop and think to be
Yeah,
able to, whether it's an elective procedure, whether it's your spine, whether it's your
totally.
knee joint, whatever. It's
Yeah.
one of those things where if you are not seasoned in it, it is definitely scary.
Yep. It is. It
And
is. Yep.
and we lose that side as being a provider of kind of being in tune with that and being in touch with that, I
Totally.
think.
Yeah. One thing that I used to pride myself on when I was a labor and delivery nurse is a lot of times, when we rush in the room because something's going on with the baby, all of the focus is on mom and the baby, right? And there's usually a partner or a support person sitting there going, "Oh my God, what's going on?" Right. And so I used to always, if I wasn't touching the patient, it wasn't my patient, I would say, I've got the person, right? I've got the partner or I've got the support person. And I would be like, "Hey, let me explain to you what is happening right now and where we're headed and what's happening." Because I just think, like, if I was that person and I love someone so much and I love, that little person inside there, and all of a sudden everybody's rushing in and shoving their hands in all these places and flipping people around and talking about a surgery and consenting to the OR, but no one's like slowing down to just talk, right? And so I've always prided myself that that was something I thought was really important because I just remember thinking that would be so scary if I was them. Well, the other night we went out to dinner with some friends, and one of our friends just became a grandma for the first time. So
Oh,
exciting.
yay!
I know. But her
Yay!
daughter was in labor for days and days, and she was texting me for advice and what's going on. And so that night we went out to dinner with some friends, and our friends were like, "Yeah, when I was baby number 3, the heartbeat, blah, blah, blah. And I got rushed for a C-section. And she goes, the hardest part is I just didn't know what I was consenting to. My
Right,
partner didn't know what they were consenting
right.
to. And it was so overwhelming. And I was like, yeah, I said, we were just talking about like from the lens of her lens and how it felt and how she wishes someone would have stopped to talk to them and let them understand what was going on. And it was that same thing, like, just having people that can, like, explain things to you, that understand the medical lingo and understand what's happening, but can take a moment to empathize that you're hearing this for the first time and
Yeah,
you're
and it's
experiencing it differently.
scary. It's super
So
especially
scary.
with the baby, like, is it the heart rate's decelerating, the heart rate's accelerating, the baby's not tolerating, the what does that mean? What is baby okay? I mean, that's the thing. It's hard because, again, as providers, this is your job, and you do this every day, and and you have to do what you do, and I think that I've become a little, stoic just because some of the things you see, you kinda have to have a little tough shell a little bit because if not, you'd be an emotional mess all the time,
Just your heart would be broken.
and the person that you're caring for needs you to be strong, needs you, and by the same token, that person needs to have you can't have a bad day either. That person wants you to be on, they're in pain, they're scared. You can't go and be like, like, be like, "Hey." And no matter what's going on in your life, no matter what you're dealing with, you have to be on, and it's hard. That's part of the medicine that's hard, and I think people have to the patients have to kinda understand that too because it's tough. It's not just you that we're dealing with, it's you plus whoever else.
Exactly,
And it's
exactly.
and it's tough to be on all the time because obviously you have your own shit that you're going through.
You know what's interesting though, and I'd be curious what you think about this, is I feel like sometimes I do that in my personal life too. Like I'm automatically the person to like solve that problem, or I'm automatically the person who stays stoic and supports everyone else in the room until I can later fall apart, right? Like whether it be a death of a family member or a crisis in the family, it's like I still go into caregiver mode first, right? And you stay the stoic one, like you and your father in law, right? You're the one asking questions, answering questions, and you don't get to be that person until much, much later who's like, "Oh my God, that was really hard or that was really scary," right? And a lot of times, I don't know about you, but the way that I am is when people are like, "How are you?" I'm like, "I'm fine. I'm good. How are you?" Right? And so you automatically deflect it back to someone else and continue to stay that caregiver and that strong person through no matter what it is that challenges us in our lives.
So is that your coping mechanism? Do you fall apart at some point in time? Or do you not? That's the thing.
I have learned, like my father's passed away, my brother's passed away. Like I've had some pretty significant things in my world. And so I think my brother died when I was 13 years old. And so even at 13, I was like the caregiver, like making sure everybody was okay. And I think that I learned later, like, oh my gosh, if you don't figure out how to take some time to yourself and grieve, it actually can really wear you down and really make you have not do well. Right. And in the end, it's like, you tell people all the time, if you don't water, it's like what's that airplane, right? If you don't put the mask on yourself and take care of yourself, you can't take care of others. And you start to learn that over time of like, if I want to continue to care and give, I have to find ways to refill myself and take care of myself at the same time. So I will. What about you?
I mean, that happens, like I think I've gotten better at that, but there's also that whole to that notion is I have been that caretaker forever, and then if I break down, it's almost like I'm disappointing myself. Like, it's almost like, "Oh my god, like, what am I doing? Why am I doing this? Is am I falling apart?" It's almost like this weird it's like you cope a certain way, and then if you don't cope that way, now you either feel you're a failure or something, or I blame it on menopause or my hormones or, like, whatever, I'm like, "What the fuck? It's menopause. It's definitely menopause. I don't know why I'm doing this way right now. It's definitely menopause. I have no control." So, yeah, no, it's definitely interesting. I think my entire life I've become that barometer. I call it a barometer. It's like if I'm hysterical and if I'm upset, then it's like, "Oh, fuck. Like, something really is wrong."
It is funny how you don't wanna give yourself that permission, though. Like, when I fall apart too, it's like, I'll say the same thing, like, "Oh, I'm perimenopausal," or, "Ooh, I just didn't sleep well last night," or, I'm just, super emotional right now," and it's like, it's okay to be a mess, but, like, I think because 'cause we're so always worried about everyone else being okay, that when you start to fall apart, you're like, "Oh, if I'm falling apart, who's gonna take care of everyone else," right? And it still continues to always put someone else in.
Well, I mean, what we do it all the time, and we do it every day of our careers, right? Like, so, I mean, imagine if you're a person giving birth and there's a little bit of a trauma and you're freaked out, and you look at you who's taking care of me and you're crying, and I'm like, oh God, like if my nurse, if my L&D nurse is crying and is upset, then something's really bad, you know. So it's kind of like that thing. I mean, you just learn it. It's a habit. You learn, and you become this person. And the crazy thing is that you know these people for like 1 or 2 days, and that's it. Like, they're not part of your life, they're not related to you, you're probably never gonna see them again, really, realistically. And if you think about it that way, the amount of patience, the amount of people that have had my energy, positive, negative, sad, happy, whatever, it's pretty crazy.
I always had that mental moment of you're part of someone's birth story. You have to be on your game. The last thing you want is to be that story, which everyone has it like, oh, I had that one nurse and she was just such a jerk, or she didn't care, she didn't take care of me. And I'm like, you can't be that person, right? Same for you, like with solving pain. You can't be that person that's negative to them and part of a story that's supposed to be going from like, in your world, pain-free to increase mobility and decrease pain, right? Mine, it's the birth of their child. It's like you can't mess that up. You have to be on your game.